part of the virus is used to bind other cells in the human body. And so far, this variant has the most mutation compared to existing ones.
Yes, it took researchers 17 days to place Omicron into the variant of concern category. For previous variants, they needed months to categorize them into the VOC. VOC is the most dangerous category among other contagious diseases. And to know more about the Omicron variant, joining us virtually from Griffith University Australia, epidemiologist Dicky Budiman. Morning, Pak Dicky. Thank you so much for joining us.
Morning, Marisa and Deza.
Yes. So, what do we know about Omicron so far, Pak?
First, that this Omicron variant has, as you mentioned, Marisa, has a lot of mutation in their spike of protein. So the problem with this mutation, the more they have mutation, the variant is, then the big possibility they will evade the immunity, because also there will be a problem for our vaccine, because our vaccine aims is to train the body, the antibody, to detect this spike protein.
Yes.
Then if there is a mutation in their spike protein, then there will be less efficacy in terms of this response to the vaccine. And also compared to, let's say, Delta, their mutation in their spike is 3 times larger than Delta. And of course, still we have to wait whether this combination of a lot of mutation in their spike protein also will strengthen their severity in others. But at least there's a very worries concern about this situation. And in the general also their mutation is much higher than others variant, because at a whole they have like more than 50 mutation. Not the 32 mutation is only in their spike. And we show this worrying concern because in the first 3 weeks the emerging of this variant, we show that the test positivity rate in one of the province in South Africa who become the epicenter of this variant has been increased from 1% to 30% only in 3 weeks. And also we saw this variant just only need 3 weeks, less than 3 weeks, to become dominant compared to Delta variant, which need at least 3 months. So we can see how fast this variant can spread among the community. And the other latest data from South Africa that the hospitalization number is increasing 3 times in South Africa. And even, yes, currently there is a mild symptom reported, but I have to be clear about this. And it doesn't mean this variant will just bring a mild symptom, because actually all variant for COVID-19 is just bring the mild cases. But the problem is some proportion of them will have the severe, will have also the long COVID. That's almost similar for all variant. So that's why it's I have to also clarify, because many international also media say, okay, this is a mild.
It's mild.
No, that's not,
No.
That's not correct.
Yes. So what do you think? I still remember we had this conversation, a similar conversation months ago, Pak Dicky, when you said, it's like if we don't get people vaccinated, the virus is just going to continue to mutate. Now, now we have lived with COVID for 2 years. Vaccination rollout has been almost a year. And we also know that a lot of African countries or South Africa have not benefited from the COVAX vaccine distribution system. What do you think of the COVAX vaccine distribution system so far? And what needs to improve, perhaps?
Yeah, for sure, this COVAX initiative, which actually gathering all the international partner, also the developed country to contribute they are contributing their vaccine to this initiative, then the WHO will lead the process to facilitate this distribution to the least middle income country and also, the middle income country. So this is very great, actually, initiative. But the problem is, many countries now more concerned about their nation. So they put this nationalism above the global collaboration. That's the problem. And they forgot that to deal with the pandemic, we need this global collaboration. We need this even national and regional collaboration. And among that top priority strategy, vaccination is one of the very useful tools currently, especially when we deal with this new variant. And then we show, because this nationalism perspective and action, the good developed country doing, even India is not yet categorized as developed country, but India produced almost a quarter of maybe a third of a global vaccine, but they halt their production because they're more concerned about their citizens. And then we show this problem then arise from Africa, the very unfortunate continent, because the average of their vaccination is very, very low. It's like compare with 100 per people, only one people who got this vaccine. And the more we put the community in very weak situation, it means no barrier, no immunity, then it's easier for this virus to infect the people. And then if we let them to circulate freely, then we let them also to mutate and also produce the very dangerous variant like Omicron.
Yes, I guess now all other countries just realize that we need to save everybody, otherwise nobody is safe, really.
Correct.
Yes.
But Dicky, I want to touch on that point more, nationalism. Do you think the regulation of prohibiting foreigners from 11 countries affected with Omicron effective enough to stop the third wave of COVID-19? Is travel ban effective?
Yeah, actually, based on the science perspective, there will be no this approach will not effective, because we have to aware and understand that when one variant emerged and found in one area, it doesn't mean it's came from that area or that country. It maybe come from, like South Africa. South Africa always found the first variant in the continent. It's because their capacity in terms of whole genome sequencing is more sophisticated than others country in the continent. That's the problem. And so it doesn't mean that this variant is original from the South Africa. And that's why when we give this, we respond this or react. I think I should use react this by ban or make travel ban on other, isolate the South Africa. That's a very wrong decision, because then we don't appreciate this country, and then we put this collaboration spirit in very low ground, and that's very unproductive in terms of global health cooperation. And again, based on our experience in terms of alpha variant, beta variant, delta variant, the travel ban is never effective. It wasn't effective, and of course, based on a science again, the most effective intervention or response to this new variant is we have to say consistent with our border restriction. We have to also strengthen our health system, early detection, including in Indonesia 5M, the wearing masks and others, and also vaccination. That's the tools that we have to use to respond to this variant.
Right. So how should countries deal with this new variant Omicron in terms of borders then, Pak Dicky? Like we know that some countries like Japan, for example, they have closed their country completely from foreigners coming into their country.
Yeah.
But some of the countries, like for example Indonesia, even Australia and New Zealand, the borders are not so strong or so tight. So how should countries deal with this new variant best?
Yeah, first, responding to Japan now, Japan, China, and also Israel, they close their borders. But for sure, it's only buying time because they want to prepare more inside or within
Okay.
their country.
Right.
But it doesn't mean they will protect their country 100%. Australia has one of the proof of this statement because Australia for many months isolate themselves, even New Zealand, but then they cannot also prevent this Delta variant. I mean, the Delta variant come to their community. That's a very real and proof for this statement.
Yeah.
And regarding the border restriction and border intervention, of course, the problem with many countries, not only Indonesia, is consistency, Marisa. Consistency in terms of putting the, like say, the restriction, the quarantine period should be like no less than 7 days. That's very, very, very important because then if we talk now, okay, we choose to have this 7-day quarantine, but
Yes.
remember early this month, even maybe last week, we still put the quarantine in 3 or 5 days. So it means there's a big possibility that this variant is already in the country. So the problem again is the consistency, the commitment, and because actually the tool is already been there, even within the country.
Yeah.
The commitment, the consistency, and the patience. We call it kesabaran.
Yeah.
The patience of people to do the 5M, wearing masks,
Yes.
is one of the biggest challenge now.
That is so true, Pak Dicky, because I've begun to witness myself, it's like on the streets, people are a little bit more laid back. I know it's like probably one or two, but it's because probably also the condition in Indonesia, we're doing quite well so far, and we hope that
Yeah.
we will be in this condition for longer. But yes, to underline what Pak Dicky said, we need to go back to being strict with our health protocol. It's like, don't let your guard down because this is our only protection in a way, while
Yeah.
vaccination is still being rolled out as well.
Pak Dicky, I want to ask you about the whole genome sequencing. Is it that important to discover which variants is which, or should we just approach it as it's coronavirus, so we should just implement health protocols and get vaccinated? Is it that important to know which variant exists in Indonesia right now?
It is very important, Diza, because the whole genome sequencing will give us, or we call it the genomic surveillance, will give us the information and data, the character of this virus or this variant, and in where the distribution or the mapping of this variant, and also how their behavior, and also from where and why. As many questions will answer by this genomic surveillance. And the problem with the many countries, including Indonesia, their capacity in terms of sequencing compared to their total cases is very low. Let's say for Indonesia is 0.2%. Even South Africa, 4 times higher. It's like 0.8% of their total case, COVID-19 cases infection, sequence. So let's see compared to Australia, it's 21%. So one thing that I want to mention is very important, that when we, let's say, categorize or put one country as the one who already detected and have or had the Omicron variant in their country, and then we have this travel ban, we have to remember, and we forgot that there's almost all of those countries has higher capacity in terms of their sequencing or whole genome sequencing than us, than Indonesia. So it doesn't mean we are safe because we don't have enough capacity in doing the early detection. So that's why again, strengthening my earlier statement that the travel ban is never effective because again, it's about ourselves, how we protect ourselves, and this whole genome sequencing should be strengthened in Indonesia, at least an approach to 1%. That's quite adequate for Indonesia for a while.
Do you have any input for the government of Indonesia so that we can avoid third wave of COVID in the country?
You know, regarding this third wave, it's very and then complex prediction, and also there will be a multi-factor will influence in this scenario. But for sure, as long as we have a significant number of community or people who don't have enough immunity in their body, so it's mean we will have this a big possibility to have the next wave, because again, it's a problem. It's a problem with their people immunity. Right? It's either way from vaccination or from the infection.
Yeah.
But of course, we don't want to put this infection as the protection, right?
Of course.
And the second is about the public health intervention. So those aspects, and including now, the scenario is worsening by this new variant, and then of course, in my prediction, the next wave is still will happen, but the big and the serious impact of this next wave, it depends on our response from now on.
And the health minister of the Republic of Indonesia also plans to provide boosters for purchase in January 2022, Pak. You know, with the presence of Omicron now, do you think it's wise to still wait till January, or should we start? Should Indonesia begin giving booster now, this month in December?
If in terms of urgency, of course, if possible, if there is a possibility to do this earliest at time, is very important to do right now, for not for general population, but for the vulnerable population like elderly, and also the let's say the community employee, like people in borders area, people in quarantine hotel, they need this booster, and the science has been show us that the booster is very effective, and one of the tools that we can deal and against the new variant is the booster.
Okay.
But I have to also raise this because through this media, I have to also remind all of us that we have to be patient about this booster. Even we all will need this, but there is a three criteria that we have to see, and also the government should consider about this booster program. First, about the ethical aspect. The ethical aspect, it's like, if let's say our neighbor still eat, let's say once a day. They eat once a day, and now we already eat twice a day. Then we feel, okay, we need 3 times a day to eat, but our neighbor still 1 and maybe 2 times a day. So we have to become ethical in consideration in this term. And the second one is about the equity. Equity is like, we have a lot of vaccine, but others only like maybe 1, and we have to distribute this fairly, equally. And the last one is the public health strategy. It means we have to prioritize the most vulnerable ones in the community, like elderly, like I already mentioned, and also comorbidity. Otherwise, if you just doing this to all population, and the problem with the our country, then the hospitalization will increase, the mortality or death rate will be increased.
Yes. Okay.
Pak Dicky, I want to jump into the topic of Paxlovid, the COVID-19 medicines. Do you think that would be effective to minimize the death toll caused by Omicron? Would it change anything?
Yeah, the problem with the antiviral now that we have, I mean, the world have, is that almost all antiviral will need to give to the patient at early stage as possible. That's the problem. The problem with this condition is that the early detection is the most problem facing by many countries, including Indonesia. So that's why the effectivity will become the very big concern, because compared to the clinical situation or clinical research, the situation is very ideal. We know from early stage of the symptom and also condition, but in community, in the real world, it's very difficult. So that's why I should say it's not really there's not really expecting that we can also put this as our effective strategy, but at least we already have this tool. Then the other challenge that we, and the action that we have to do is like, we have to strengthen our early detection. In terms of this, of course, then rapid test antigen will be very important, and also self-awareness about the symptom of us. So when you feel like, okay, you contact with someone at early stage as possible, you have to, to contact your doctor, and then when you do this rapid test antigen directly, and then they will be effective.
Yeah. Well, thank you very much, Pak Dicky Budiman, epidemiologist from Griffith University Australia. It's always great to listen to your expertise on the latest development around COVID-19. You have a lovely day.
Thank
Stay
you
healthy,
for
Pak
having me.
Dicky.
Thank you for having me. Bye-bye.
Bye. Right.
So if we can sum it up, stick to your health